babe, listen, I don't know, she didn't say exactly. I'm gonna have some blood tests and maybe you're gonna have a check as well. But listen, I don't know everything and she's probably going to explain more when we get there. But can we go together? I don't want to go by myself.
What are the investigations for infertility? This video looks at some of the tests that we do for anyone or any couple who are experiencing challenges with getting pregnant. We will explain what the tests are and why they are necessary. Hi everyone, welcome to the channel. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Infertility can be primary or secondary. Primary infertility means that a couple has never had a child, while secondary infertility means that one or both partners have had children in the past but are struggling to get pregnant now. Infertility can happen at any age, so being considered too young is not a reason to delay seeking help with this problem. Some studies indicate that by having sex twice or 3 times a week, more than 80% of the population will fall pregnant in 12 months. If as a woman you're over the age of 35 or have conditions, for example, PCOS, polycystic ovary syndrome, endometriosis, PID, fibroids, and so on, it is important to speak with your healthcare provider quite early about your fertility and options. Similarly, men may have conditions that affect their fertility, such as previous cancer treatment or having had a sexually transmitted infection in the past. We recognize that advancing age or specific conditions can have a more serious effect on fertility, and we need to address this earlier than waiting for 12 months. For most people who don't have these additional problems, the advice is to have regular sexual intercourse twice or thrice a week throughout a woman's cycle for at least 12 months, because pregnancy is most likely to happen. In addition, couples should prepare for getting pregnant by doing the following: keeping to a healthy weight with a recommended BMI of between 19 and 24, stop smoking and stop alcohol consumption. These habits can affect sperm and egg quality and fertility in both men and women. Smoking and alcohol can affect your baby's growth and development. So women trying to conceive should not smoke or take alcohol. For men, the recommendation is not more than 14 units in a week, since excess alcohol consumption can affect your sperm quality. Next, start taking preconception supplements. Folic acid is particularly key for every woman because it helps in the healthy development of your baby's brain and spinal cord. Avoid illicit, street or recreational drugs, but be aware that some over-the-counter medicines can affect fertility. An example is some members of the class of drugs known as non-steroidal anti-inflammatory drugs. For instance, naproxen. Naproxen is a common medicine that we use to treat joint-related pain and inflammation. Next, stress management. When a couple come to see a doctor about fertility problems, they are already going through a lot of stress and anxiety. This can affect your sex drive and the frequency at which you have sexual intercourse. The process of investigating or testing for fertility also brings stress along with it. It's important that couples are aware of these issues and either have counseling or a way to ensure that they are not overwhelmed by the process. So these are some of the lifestyle behaviors that will support fertility and pregnancy. So now let's look at the tests that are important for investigating infertility. There are many causes of infertility. Broadly, we talk about the male and female factors. According to a UK study, in about 40% of cases, both partners have some abnormality. It could be problems with the sperm being produced, problems with access to the sperm, or even the quality of the sperm. On the other hand, there could be problems with the womb, the cervix, the ovaries, or the fallopian tubes in the woman. So the tests that we will do in the first instance tend to detect where the cause lies for the infertility problem. They can also help in determining which treatments are most suitable. When investigating infertility, it's always better to deal with a couple so that any results and treatments are addressed for both of you, even if the cause appears to be predominantly in one person. Of course, this can be challenging for some couples, but the infertility treatment process is a long journey. A lot of mutual support is important. So first, let's look at primary care tests, which your GP will conduct as part of your initial assessment before we refer you to to your specialist. For men, the main tests are: 1. The semen analysis. The semen analysis gives us valuable information about the quality of the semen and whether it can fertilize an egg. Essential aspects of the semen analysis include the quantity of the sperm present, their structure, and how well they move. Insufficient, abnormal, slow, or poor moving sperm will struggle to fertilize an egg. The semen analysis results will prompt further tests in the man to identify structural problems leading to trouble with sperm quality. Number 2, screening for chlamydia. Chlamydia is one of the germs responsible for sexually transmitted infections. If present, this infection can affect fertility. It's important that both men and women are screened for chlamydia. Now, for women, the main primary care tests are blood tests, including the mid-luteal progesterone. This test is performed in every woman to confirm whether she is ovulating or not. The blood sample is taken 7 days before the date of your expected period. That is, a 21-day progesterone if you have a 28-day cycle. As I mentioned just now, chlamydia screening is also important for women to ensure that there is no infection that can affect fertility. Women with irregular cycles may need to have other tests to establish whether or not they are ovulating. The first is another serum progesterone test. Depending on the timing of the woman's menstrual period, we may need to collect progesterone later than day 21. For example, day 28 of a 35-day cycle. In addition, we will continue doing weekly blood tests for progesterone until the next menstrual cycle begins. This helps to confirm whether or not you are ovulating. Another useful test for women who have irregular cycles is checking the levels of FSH, follicle stimulating hormone, and LH, luteinizing hormone. These measurements are helpful in women who are not ovulating or not ovulating regularly. Thyroid function tests we will do if we suspect you have symptoms of thyroid disease, while your blood prolactin level becomes important if you have a symptom like galactorrhea, where milk leaks away from the nipple outside of pregnancy, or if you have other symptoms suggesting ovulation problems like polycystic ovary syndrome. So these are the basic primary care tests we will organize for you while arranging a referral to a specialist. Depending on their results, you will advance to the specialist to have further tests or treatment based on the results that we already have. Specialist tests for women include tests looking at the patency of the fallopian tubes. In other words, we want to check if the fallopian tubes are blocked or are able to allow the sperm and egg travel freely through them. First is the hysterosalpingography or hysterosalpingo contrast ultrasonography. We will perform this test on women who don't have any other conditions like PID, pelvic inflammatory disease, endometriosis, or a previous ectopic pregnancy. Please check out my video here on extreme pregnancy symptoms, where I explain the conditions that can increase your risk of developing an ectopic pregnancy. The hysterosalpingography or HSG test is an X-ray and it looks at the womb and fallopian tubes. You're given a special contrast dye through the vagina. It passes through the womb and the tubes. At the same time, a radiographer takes pictures or images of the womb and tube, indicating how well the dye passes through the organs. The hysterosalpingo contrast ultrasonography or the HICO-C test with the dye uses the dye to allow us see the fallopian tubes on an ultrasound scan. What about a woman with conditions like PID or a previous ectopic pregnancy? Well, she will be offered a diagnostic laparoscopy and dye. This test allows us to assess the tubes as well as anything else that might be going on in the pelvis. During a laparoscopy, your surgeon will assess your tummy and your pelvis without making large cuts into the skin of your abdomen. To do this, they'll use a device with a small camera attached to it known as a laparoscope, and this procedure is also known as minimally invasive surgery or keyhole surgery. And what about the men? Under specialist care, the sperm and semen analysis continues. If the initial tests indicate the sperm are abnormal, there will be more detailed examination of the sperm, culture tests, hormone and endocrine tests in addition. You may also need to have ultrasound scans of your genitals, including the scrotum and testes, that may show conditions, for example, varicocele. A varicocele is where varicose veins develop inside the scrotum. This condition leads to low sperm production and quality, so it affects fertility. It can also cause uncomfortable scrotal pain. Next, men may need to have testicular biopsy if there are concerns about sperm production. For the biopsy, the doctor makes a small cut through the skin to get a little piece of testicular tissue. We will examine this tissue under a microscope, and this will tell us if there are any problems with sperm production. For example, there may be a blockage in the tube that carries semen and sperm from the testis where it's produced to the penis where it's ejaculated. This of course can cause infertility, so by doing a biopsy we can identify these problems, some of which can be corrected with surgery. So thank you for watching. I hope this video sheds some light for you on the investigations for infertility, which can vary from person to person depending on your specific situation. You may have some or all of these tests on your pregnancy journey, and this video should help to clarify some of what they mean, how they're carried out, and the implications. But I'd love to hear from you. Let me know which of these tests you find most challenging to understand and why in the comments section. Please don't forget to give the video a like, and of course consider subscribing to the channel. Next, why don't you check out this video on factors that affect fertility in Black women, and I'll see you again soon.